instead of any further questions, because Ron was like heavily involved in how we figured out who was going to speak tonight.
Okay. Well, I felt that
with the
like I said, there's only very few people here. Robert Mayer wasn't here. He's from the Tea Party folks. Yeah, I've only got maybe about 3 or 4
we had a
people.
number of requests from people we wanted to see.
Right.
We wanted to make sure we represented the business community.
What about the taxpayer?
I think the taxpayer was well
The chamber.
I don't think so.
We may disagree.
Do you have your card? Can I see your card? I'd like to see your business card.
Sure, you can have my business card. But if we had, we originally started out with about half a dozen people, but more and more people kept asking to speak, to represent different parts of the district. Remember, the district is not just Tucson. We wanted to make sure that rural health care was represented. That's why we had rural
Yeah, I'm
health care.
peaceful here. That's my house.
So, it was trying to make sure we had geographic diversity, diversity of points of view. I mean, too many congressional meetings in the district you get from Goldwater Institute coming. That was important message that we could bring. No one else could bring. So, we tried to make sure that we had the
No, I'm glad there was somebody there. I mean, I just felt like the deck was stacked a little bit. What about Tom Jennings and the Americans for Prosperity?
People contacted us and asked to be on. They had a shot, and these people may not have contacted us. They didn't contact us, but I know that.
Well, I'll be honest with you. I found out about this about 3 hours before it happened.
Well, it's been
and I'm on Gabby's list, by the way.
Well, it's been in the making for about a month. And we reached out to any number of groups. There's listservs that took a message.
I'm on Gabby's list. I'm on Gabby's list.
Yeah, you probably got something that way, I've seen.
I don't know that I did.
Well, we sent out postcards to about 100,000 constituents, which is something that's never done before for town hall. And I don't know if you got one or not, but 100,000 people is a big large chunk of it.
Yeah.
So people had an opportunity.
All right.
I think, there was a lot of different views we represented. I don't think any of the views.
I think the single-payer system and a lot of crying, a lot of whining, a lot of, people help me with my poor me story. It's not America, man. But I don't think that's what the heart of the district is.
Well, their views were represented, but so were the views of people who don't think the single-payer system.
You had 3 or 4 people out of the 12-person staff here. 12 people were here to present. There was Gabby, there was Dr. Carmona, Dr. Bootman. That's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. And you got 4 of the people who are against the single-payer system, or at the most don't want a single-payer system.
And we also
you're
heard
saying
some people in the audience. Right?
And how many of those people in the audience were people for against the single-payer system?
I have no idea.
Exactly.
Well,
so Bob, I know you're working for Gabby. I know you're a good guy, but don't tell me that you're here to represent. You want to collect.
We may not have had a Tea Party person here, but we definitely had that point of view represented tonight. So
I'm sorry
that you weren't up here. You could have. Did you have to speak?
I did. I had one. You had one person out of 6 people who opposed the idea of a single-payer system. That's not honesty, man. That's not honesty.
We may disagree on that, but thanks for your opinion.
You done?
No, are you?
I just don't think you're listening.
I'm hearing you, but we may not agree. That's all I'm saying. Is it okay that we don't agree?
Oh, it's fine that we don't agree. I just think, to be honest,
You're here. You're making your opinion known. We hear you.
But I don't feel like any of the stuff here. And I didn't say that anyone.
I was part of the group that helped decide who was going to speak tonight and who wasn't. And one of the things we took into account was, there are a lot of aspects of this healthcare debate that don't involve single payer versus non-single payer. That this has become clearly a very political debate. Teabaggers, left, right, and this and that. All of it. There's a whole lot more involved in this discussion, so we wanted to be careful tonight to sort of hear from the left and hear from the right on the political point of views, and that tends to be where people fall on the single payer versus non-single payer. But also everything in between. The stories that we heard tonight of the folks that are suffering from severe chronic illness, specific issues on mental health care and drug management, and so we wanted.
All I'm saying is that she's got a reputation in this town for stacking the deck, and she did this with the border checkpoints. And look, and I'm here, and like when I hear something the first time, I'm like, I take it with a grain of salt. I see for myself, and I see tonight, and hey, you know what? You could have put out 100. I only got your word for it. And so that's
100,000 mailings.
100,000 mailings, and people, and you say, and you invited other groups. I'm going to talk to Tom Jenny tomorrow. I'm going to talk to John Justice tomorrow. And if you
John
invite,
Justice was broadcasting about this for several days.
And if you want,
assuming that people came,
if you want, if you
right?
said,
is that true? John was talking about it on the radio, was he not?
I don't even listen to the guy.
Well, he was. And so,
but I mean, if you invited those people and they blew you off, hey, then you've got the floor. You've got the ball. But for you to tell me that you've had, you're not saying you have a balanced point of view, but that represents the district.
What Pierre
it just seems like you're stacking the deck.
What Pierre said is absolutely correct. We tried to get geographic representation, different points of view from different perspectives on the healthcare issue. It's not all about either left or right. There's a lot of people in the middle who want to talk about healthcare issues from their perspective, and that's what we tried to do. I'm
saying you get yourself. You allow yourself to be involved, to be vulnerable to attack, that you're stacking the deck.
Well,
that's all I'm saying.
Thanks for coming.
That's a matter of opinion, I think.
Okay. Well, I got your card, and I'm going to talk to Tom, and I'm going to talk to John, and I'll talk to the folks. And if
you probably talk to people on the left who weren't invited either.
If you're legit, then hey, then it's good to meet you.
It was nice talking to you.